first one. This one is going to be for Ian. Question was, I'm one community CYP specialist asthma nurse in a London borough facing huge challenges, including local population deprivation and local government departments. Can you suggest some small steps I can take to help reduce the poverty divide and inequalities for families who have CYP living with asthma?
Yeah, I mean, I'll start with the slightly negative answer, which is that a small step won't do it. So actually, what's needed is for you know, for a wider system-wide approach to all of this. But if the question is what can you do in the clinic, I think again I come back to the point that the best thing that we can do to reduce inequalities is standard-based care. So all the pushback we get about pheno and annual reviews and all this kind of stuff, I think it's probably high time that we, and again, the word reform is going to come up a lot in NHS type discussions, isn't it, after what Wes Streeting has said. But I think we just haven't got our systems right, and we haven't tailored them around the kids that you see. So you'll be seeing kids there and not a million miles from you in you know, rural Kent or rural Surrey or, you know, somewhere really nice, that like the system will be exactly the same. So we need to be able to tailor the system. And I think in terms of things to do in the clinic, it does come back to this idea of person-centered, evidence-based care. I think you have a strong voice if you don't have the facilities that you need to deliver national standards of care for asthma. And we see this in the National Respiratory Audit Programme, that many places don't have nurses. We know that many primary care centres don't have pheno. You know, kind of tying those things together enables you to do the best job that you can clinically. And if we're thinking about individual things that we can do, delivering the best care is top of the list. Outside of that, there is, and I won't necessarily give that here, but there's a longer answer about population level approaches, and we've had some benefit from that in Liverpool as well, and across the northwest, that requires a bit more strategic change, but actually not that much investment.
Yeah. Thanks, Ian. Yeah, would certainly echo that. I think a big, certainly my experience, a big part of dealing with these issues requires, and I put it into the chat for those of you who've had an opportunity to read it. It's kind of system change, strategic change that's absolutely critical. You need whole system approaches. You need kind of pathways that work across the whole system, multidisciplinary working methods of identifying those cases where there is complicating factors impacting asthma control, such as poverty, and then the kind of principles of equity rather than equality. You know, some of our cases will need a significantly greater amount of work done in order to give better control than others, and we have to recognise that, and our systems need to flex to change that. And that does mean slotting in with other significant pieces of work going on. This shouldn't be a problem that a CYP asthma nurse is having to fix. These are, you know, it's important to slot in with other important pieces of work like integrated neighbourhood teams, data programs that are happening, population health management approaches that all ICBs are following. We need to ensure that we're tagging into that, and they're doing it for children with asthma, along with, well, children more broadly as well.
Yeah.
Ian, go on.
Yeah, no, I was just going to say, we keep saying to our guys that wherever we go, we say systemic problems need systemic solutions, and by definition, anything else is just mitigating against the effect. So this is very much about, as Oliver says, what you do in clinic needs to be equitable and fair.
Fantastic, thanks. Thanks, Ian. All right, this is one for Rosamond. Rosamond has been able to join us. Thank you, Rosamond, for jumping on. I hope you gave them all a good talking to at Sky. Gave the public a proper talking to, that we've that we've all been able to spread the message. So a question here came in earlier: how can the media strike the balance of raising awareness of asthma and its seriousness, but also portraying well and empowered people with asthma? What are your thoughts about that?
The good news for everyone is I met the Mr. Wes Streeting this morning, and that word reform, oh dear. Apparently he said, I am going to be happy with the announcement for today. I think maybe he's talking about preventative medicine. About the media and asthma, well, the reason why, and my apologies humbly, and I have to take my opportunities when I get it. The reason I wasn't here this morning is there's a report about toxic air in playgrounds. So every single playground is breaching the WHO limit. So that's what I was going to talk about that. And yeah, I'm very mindful about not trying to scare people. But then on the other hand, I remember when Ella was ill and talking to Sarah, the nurse on the ward nurse at Lewisham, saying because asthma is really, really common, no one takes it seriously. So we've got, and people still say to me that word, I think they can't believe people die from asthma still. So we don't want to frighten people, but we have to be truthful as well. I think I have an ask for everyone in health for today. There's an environment improvement plan open, and it's going to close at the end of the year. And I now see excellent news. We now have air pollution as one of the triggers. We need to get something in that environment improvement plan on air pollution, because the bad news, if you haven't been following it, it's not in the manifesto. It is nowhere to be seen. The only clear win we can do is get something in the environment plan short term. Otherwise, nothing's going to be done about it, and we're just going to be campaigning, and nothing's going to happen. So that's my big ask of people in health today. I think we can get. I think individual stories matter. But also, because asthma is so common, we don't want to scare people, but we also have to say to people, you know, not taking your medicine, not using a spacer, not going for your asthma review, you know, not going 48 hours after an asthma attack. You know, sadly, people do die. And I think, is it 1 in 11 children have asthma? I think we need the media to actually help us highlight personal stories, because I think they actually go a bit further. I think we need to keep Sadiq Khan as an ally. He does well for us, but I'm not also about putting out scare stories. So when I do go and talk in schools, although Ella has died and I know children have asthma, I managed to bridge that gap. You know, I don't leave there with children crying and scared that they've got asthma. So, and we also don't need the media to sensationalize it, but we do need to have a look at what water are doing, because they seem to have caught the government's ear using the word sewage. And I keep on asking people, what can we use instead of toxins going into the bloodstream? So I do think we need some buzzwords to get the public on board. Everyone's talking about water, but I got told yesterday we breathe 13 kilos of air every day. And no offense to water, that's just as important, but air pollution, in my opinion, affects more people. When we look at non-communal diseases, that is going to have more of an impact. So that's going to be my message to Mr. Streeting. Apparently he has an open diary for me, so if you have very small asks, please email me. As you said, Ian, systemic change, you can advise me what I need to say to him, but we do need the media to support it, not just once a year when Ask About Asthma has come. What I find is, until a new piece of research is out, it kind of goes quiet. Then suddenly there's a piece of research and then they'll call me, and then you go on for 24 hours and then nothing else. But I think we need to educate the public about the dangers of asthma. I think they seem to think it's something that happened to me and my child alone, and not the wider thing. I still believe there is a lack of understanding. And for people in health, I will always go back to the coroner's third ask about everyone in health needs to be aware of the impacts of air pollution. I don't know whether as a whole, I don't know what the Royal Colleges are doing. Oh, I see Ian's doing that shaking of his head. We are 3 years on, and I don't know how far it has been embedded with new students coming along and things like that. You can tell me more than I know. But yeah, I don't think it's taken seriously, if I'm being honest. They think it's something you can just pick up salbutamol and just squirt it and then all's okay. That's how the general public perceive asthma.
Yeah, thanks, Rosamond. There's a lot of still a lot of work to do from media messagings. Then Ian, you were, I think.
I was sadly shaking my head because I do agree with you. I mean, it's been there. I mean, you know, and I know the paperwork from Ella's sort of reopened case a few years ago. Some of that is public documents in it, and in my report for that, they said, is it just the case that we didn't know about air pollution? And I said, no, we knew about it since the 80s when I was in school, right? It's just that we don't prioritise it because of various reasons. And I think, you know, we're always up against the idea that respiratory disease, you know, obviously not in individual cases or anything, but if you look at population level, more than any other type of disease, respiratory disease is a disease of you know, or are diseases driven by the same things associated with poverty. We know that the air pollution, you know, we focus a lot on roads, rightly so, but actually industrial pollution that goes alongside it. They've been getting away with stuff, and I mean literally getting away with stuff that that is illegal for years and years and years. And when people like Rosamond put their head above the parapet and are brave and eloquent and saying this is dangerous, you know, it always gets labelled as a barrier to economic progress, and ultimately it just comes down to children matter less than money in our country. And I think Rosamond's exactly right that we need a momentum around this, and maybe there is something. It's a good point. Maybe you know you're quite right about sewage. Maybe there is something about how we frame the argument.
Could I just very quickly ask about wood burning and the way we treat it compared to smoking? Because I can imagine when I used to go to hospital, I used to be asked, do you smoke? Obviously, because then I had asthma. I don't know how clinicians feel about finding out whether people, because we now know wood burning is toxic. It's just a question. I'm just wondering whether that's something we need to find out. Whether I'm not saying we need to go down this route, but we now know how toxic wood burning is regarding PM10 and PM2.5. I'm just saying, if someone was burning wood in their house, do we treat it? You know, you've mentioned vaping, and I got slaughtered a few years ago with Jonathan Grigg talking about popcorn lungs. Apparently then I was scaring people, and this was what did they say, Rosamond? This is a good thing for all those people smoking, and now I hear people are addicted. But I told people, oh my God, I sound like the bearer of doom and gloom, but I did warn people. Jonathan Grigg briefed me about popcorn lungs, and I remember talking about it on the media, and people didn't really want to hear it. And it always comes back to bite us, doesn't it, eventually?
Well, I think it's an interesting one about the wood burning. I think it feeds into these questions about how much do people know about indoor air quality, and to what extent then do we share that with patients, with children, young people, and their families. And I think it's a two parts. I think you're absolutely right to flag it, Rosamond. I imagine a majority of people wouldn't ask about whether there's a wood burning stove in the house as part of an asthma review, and ought to, along with considering all aspects of indoor air pollution. It kind of leads on a great segue into the next question. It's which is for Shelley and Ian. So what engagement is being undertaken with housing authorities and local authorities to look at causes of indoor air pollution? At the moment, it feels like we're trying to tackle the problem with medication, but what is being done about prevention? So in your experience, maybe we go to Shelley first, and then Ian, if there's anything additional in your experience you'd like to add.
Hi, yes, I'm happy to take a stab at that question. So in terms of raising awareness and working with local authorities, we know that there is much work to be done in terms of making damp and mould and that link between health and housing more clear with our local authorities. Some are very clear that there is a link and they understand that, some maybe less so. So there is work to be done. There is also work to be done with tenants to ensure that they recognise also the danger. Some people think, oh, it's just condensation, it's no big thing, but they need to understand that that can lead to the growth of mould, and that can also undermine their health, and all of the care that's being taken place in the healthcare setting is undermined by the conditions, the environmental conditions at home. So, I mean, housing in nationally is a complex issue. Can't really be tackled within the scope of this project, but raising awareness and ensuring that local boroughs have acknowledged it, have it within their strategies, are looking for it in terms of their responsibilities as maybe social housing landlords. We're working with both social and private landlords, and as you can see from the pilots that are being taken forward, they will involve both social landlords, and the private rental sector programme also is directly focused on private sector landlords. So it's about ensuring that the tenants understand their responsibilities and their what should be what they should expect from the housing that they live in. They understand an escalation path. Now, that's not always clear, and I noted that there's a question there about frustration and feeling useless in terms of trying to escalate matters on behalf of vulnerable tenants. And that, again, that is, we understand that, and I've undertaken an assessment of a cursory look at some of the escalation routes across the London boroughs, and it's not easy, it's not straightforward, and there are ways in which we can improve this. So we will be doing some work next on algorithms to just help the healthcare workers who are within the patients' homes to understand the steps that they can take more readily. There will be obviously work that will be directed towards the patients to understand what they should expect when those steps have been taken. And we will also be working to improve awareness amongst both social and private landlords. So yes, it's a very complex issue, and it does require a multi-pronged approach.
Ian, anything you want to add to that?
Yeah, just a couple of brief things to that excellent and comprehensive answer. So I think there are a couple of approaches. We, as some of you may know, we set up a clean air clinic in about 2019, 2020. And that's very much about advocating for individual families. There was a comment in the chat about this, and we see children virtually from around the country, and we get results within weeks. We get them moved, and we're outside the scope of this panel discussion, but we're just writing up a paper on how do you write a letter about a family and housing, because as Shelley's just said, the whole system is a complete mess, and how do you help individual families through? From a systemic perspective, we have linked with our so across the Northwest, and one of my roles is the Northwest asthma CYP lead, and with the excellent team that I have there, we've now set up a Northwest Housing and Health Task Force strategy, and I think that's useful and important. I think we are not great at overlaying our hotspot areas of where people are worried about housing and where people are worried about health and what you can do there. And the answer to that is a kind of place-based sort of hyper-local approaches to things, which does take more work, but is very much about empowering communities. And I guess our experience has always been very difficult with private landlords, because parents are very worried about being kicked out, but the new Labour legislation, which was announced this week about protecting the rights of people, of renters, I think becomes really important in that. So we should start to be able to advocate more strongly for them. And yeah, I think it is about people coming together to wrap a service or a care or a civic intervention around children, rather than shoehorning people here and there. And like I say, my email address is in the chat. We have seen high profile and difficult cases from around the country and helped the local team to get a move. So we are happy to take those referrals, and there's a similar clinic run from Bart's in London as well.
Fantastic, thanks, Ian. So just going to bunch a couple of questions together here for Mira. These were about kind of generally questions around kind of vaping and vaping cessation. So Mira, you referenced some vaping guidelines. I think there was a question is, are there any vaping guidelines? So if you could kind of mention that. And then are you personally aware of any kind of plans nationally to start picking this up, either through at sort of OHID or public health, and then maybe Shelley might have a view on that as well. So Mira, yeah, vaping guidelines first, and then any national plans that you're aware of.
Yeah, so there is if you Google the vaping cessation guidelines, it's really for adults in from the network, where you can actually do your own kind of module for smoking cessation as well. It's NCS. I can put it onto the chat. So that, but like when you look at it, you can just have a look at it. But like it's really for adults, because they mentioned about start easily, or have a nicotine replacement therapy and so and so. But then you go to GPs and they will say, I can't prescribe nicotine replacement therapy patch and whatever, because this is for smoking cessation. So and this is not for under 18. Well, we know the NRT is really from 12 and above, but they still kind of confused that, but I heard from public health that you are not inhaling enough nicotine for us to give the NRT the same as smoking. Fine if they vape once or twice a week or very little, but if they are already addicted so badly, in my opinion, the NRT is pretty much the same as if you're smoking. Patch and inhalator is the same thing. And if it's prescribed for 12 and over, then I don't understand why why we can use a common sense and use the same thing. So it's really it's sad that adolescents come to a GP and they are 16 years old and they said, look, I have this issue. I have I'm addicted to vape, and then GP will say, well, I don't know what to do with this. Sorry. And they can't even say, which is fine, but they can't say, oh, can you go to a specialist smoking service and they can help you, but they don't, because they don't even see under 18 for smoking, never mind for vaping. So the second question is, sadly, I don't know of anything that the public health is doing for vaping cessation, and this is why I am very keen to speak to Lambert together, because they will have the board who can make that decision to have about the vaping cessation. But the problem is that the Tobacco Alliance wanted to see me as well, and I am worried that the decision makers for this are a little bit worried about I am trying to scaremonger people, and they are really they are determined to do 2030 smoke-free England, UK, the whole world, and they think the vaping is just the number one, tool, and they don't want anybody to really kind of rock the boat. So I'm a bit worried that they think I'm trying to make the vape as a vaping cessations to be the baddie, which I'm not. I see adults, parents in our service, and if they tried everything, I'm the first one to say, have you tried a vape? But this is an adult who's been smoking 15, 20 a day, So I am, I agree with vaping as a vaping, smoking cessation, but I don't see any movement about anywhere out there, public health or anywhere else, trying to put adolescents and children priority. The priority is adults. So, and I'm trying to change that.
Yeah, fantastic. And I'm minded of your analogy, which I absolutely loved, which is we'd never suggest to somebody that they try a little bit of methadone because it's not as bad as morphine.
Or like, yeah, the whole point is like, exactly, the whole point is, of course, methadone has its use, but are we now saying have a methadone and off you go? You know, they will see this patient. And to be honest, this is my opinion. For example, like I see many young people, adults, 25, 27, who are dependent on a vape and are struggling. They are struggling. They used to smoke and they're now vaping and they're asking me for help, you know. So and nobody sees them. They go like, off you go, have the vape. And now they're struggling with vaping addiction, but thank God they are not smoking tobacco. But they have issue, they have anxiety, and we are not helping them. So, you know, like we wouldn't do that to someone who we say, can you have a methadone? You know, yeah. Off you go and have it forever.
Thanks, Mira. Shelley, are you aware of any national plans or regional plans from an OHID perspective?
From an OHID perspective, I am aware that in London we do place an emphasis on reducing smoking and exposure to secondhand smoke, and that does include vaping. So that's what we push. What's being delivered on the ground is subject to a program of work. So we're ensuring that we keep step in terms of the smoking cessation agenda, and it has to include vaping now. So I know that there is work being undertaken on that particular program of work, although it's not my particular program of work, but it does happen. And also including London's air quality generally is another key focus of work for us at OHID London. So I'm happy to share with my colleague what our expectation is across our region. If I can also, I will also share what the national perspective is as well, so we can gain some reassurance that vaping is very much a part of the agenda.
Fantastic, thanks so much, Shelley. And then just last minute before we wrap up for lunch, like to very happy that we have Rosamond with us. Rosamond, any last kind of thoughts for this morning's session that you want to share with us, just to wrap up for this morning? Oh, you're on mute there, Rosamond.
This is the 8th one, if I'm right, and it's about the quality of life. I think we need legislation. I've got to be honest, and you know, you do fantastic work as health professionals, but I am learning now it is going to take a bit more than that, and we have a new government in, and I suggest we need to start talking to them, because air pollution is nowhere on their agenda right now, and I hope they don't feel they've done enough. I'm a bit concerned about that. So I think going forward, we need to be in talks. He's talking about a preventative model, and I believe air quality needs to be in the midst of that. You know, when he's talking about reform, I have heard him digital, he's talking about more doctors, and there's nothing about air quality or dirty water. So I do think we need to start having that conversation with him.
Fantastic, thanks so much, Rosamond, and as broad as possible in our views of preventative, including poverty and all of the other additional bits as well. Brilliant, so thank you all so much for joining us this morning. We have another 2 fantastic sessions later on. A huge thank you to our speakers from our second session, and we're very grateful to you for taking the time.